Good morning, grade 5, section Jeremiah, and welcome to our lesson in this fourth quarter period. So I am Numerous Sahoynan, and I'll be your health teacher in this particular subject. So before we proceed into our next topic for today, I have prepared here a game called Find Me Game. So let us encircle and identify the materials and tools inside the go bag kit. Okay, I want some volunteers. Okay, Jacob. Okay, very good. Gloves. How about you, Sophia? Okay, very good. Ice pack. Okay, TG. Okay, very good. Bandages. How about you, Lovely? Okay, very good. Alcohol. Okay, Chris, how about you? Okay, thermometer. And how about you, Mark? Okay, very good. Adhesive tape. Okay. And what else? How about you, Giselle? Okay, very good. Scissors. So there are last two pictures here. So how about you, Mark? Okay, very good. Medicine. What else? Okay, Hannah? Okay. Medical tissue. Okay. So, okay. Oh, there is last one. Last pictures. Okay. How about you, Kathleen? Okay, very good. This first aid kit. So thank you, class, for your participation. Now, so what do you observe in this game, class? Do you have an idea now what is our next topic for today? Okay, TG? Okay, very good. Our topic for today is all about first aid principles. Okay, but before that, class, let me present to you our objectives for today. Okay, at the end of the session, learners can identify basic first aid principles. Second, develop appreciations of first aid principles. Third, demonstrate appropriate first aid principles using emergency situational scenarios. So, okay, let's move on first aid principles. So, what is first aid principles? Okay, first aid principles. What is first aid principles? So first aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury with care provided to preserve life, prevent the condition from worsening, or to promote recovery. So first aid class is very important, and the first immediate actions or assistance that we can do to give any person a care that they need if they encountered suffering. It's either it is a minor or a serious illness or injury. So first aid class also includes initial interventions in a serious conditions prior to a professional medical help being available, such as performing cardiopulmonary resuscitations or the CPR while waiting for the ambulance to arrive. As well, class, do a complete treatment of minor conditions such as applying a plaster to a cut or a wound. So class, with the help of first aid, we can be able to help a person who is in need to provide care, to preserve their lives, prevent their conditions from worsening, or to promote recovery. So, okay. So the key aims of first aid can be summarized with the acronym of the 3Ps. So let's find out the 3Ps. So the 3Ps class is preserve life, prevent harm, promote recovery. So the primary goal of first aid class is to prevent death or serious injury or illness from worsening. So preserve life. So let us first tackle how to preserve life. So the overriding aim of the medical care, which includes first aid, is to save lives and minimize the threats of death. So first aid must done correctly to help reduce the patient's or a person's level of pain and calm her down during the evaluations and treatment process. Providing CPR or attending tracking a person are two examples of a life preservation in a first aid. So, maintaining air circulations in the body and clearing blocked airways while waiting for ambulance, medics prevent other severe conditions like brain damage and even a heart attacks, which can happen within a minute. So by this first aid, we can really state that it is very important for it to help us to preserve life, to help a person preserve his life if they are in emergency situations. So, prevent harm. Okay, the second is prevent harm. So, first aid prevent harm by addressing both external factors such as moving patients away from any cause of harm and applying first aid techniques to prevent worsening of the conditions. So, such as applying pressure, we can use the ice bag to prevent the conditions, to put some pressures to stop the any kinds of injuries, the bleeding wounds, and cuts. So, and most especially to assess the unconscious person to avoid it leading to death and harm. So that is one way of giving a first aid to a person. So, first aid principle class, it is very important in quickly responding to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical professional arrives to administer more specialized treatments. That is our role class as a person who is encountered a person who is suffering from injuries or emergency situations. So the third is promote recovery. So first aid also involves trying to start the recovery process from the illness or injury, and in some cases might involve completing a treatment such as in the case of applying a plaster to a small wound, providing CPR, or any kinds of actions that we can do to help the person. Recover from unconscious situation to situation. So, by this class, by this 3 PS, we can realize how important first aid and its principle for it preserve life, prevent harm, and promote recovery. With the help of this first aid, we can save lives and minimize the threats of death. Now, let's move on the basic first aid principle. So, so in providing first aid to a person who is suffering from illness or injuries or any kinds of situations, we should follow the basic first aid principles, the proper steps in helping an unconscious person or those persons who suffer emergency situations. So the first step is ensure that it is safe to intervene. So that is the first step. So when you are going to help a person, so you should ensure first that it is safe to intervene. First, check the scene for safety, for it is very important to ensure that it is safe to intervene to avoid any harm or casualties. So before rushing to the injured person or patient, make sure that the situation is safe for you and other people or bystanders. So the decisions to act appropriately with first aid can mean the difference between life and death. So begin intervening, when you are going to intervene, begin with introducing your first. So to the injured or ill person. So explain first that you are a first aid provider and are willing to help. So the person or the injured person must give you a permission to help them. So do not, I have a tip for you, do not touch them until they agree to be helped. So if you encounter a confused person or someone who is critically injured or ill, you can assume that they would want you to help them. This is known as implied consent. So if the situation is too dangerous, stay back and wait for professional assistance, like the ambulance or any kind of medical assistance. So the step 2 is a first aider safety first. So in the step 2, if you choose to provide first aid assistance, you have a duty to use your knowledge and skills responsible way. So before rushing to the injured person, patients make sure that the situation is safe for you to help. So always remember to protect yourself first. Never put yourself at risk. So in helping a person suffering from either a minor or serious illness or suffering from injury or illness, you must use a protective equipment or PPE or the equipment like PPE, sanitizer. First, when you are going to help a person, sanitize first. That is the first way to avoid any kind of infections and any kinds of that can make the situation worse. Like for example, the gowns, the gloves, face shields, pocket mask, or a CPR mask to help yourself and the person that you help safety. So the third step is conduct an initial assessment. So in this step, you should you can conduct here the EBCCS assessment, or the A stands for the airway, B stands for breath, C stands for circulation, C stands for consciousness, and S stands for safety. So in the first aid assessment, you will do when you meet your patient. So this assessment is repeated whenever you suspect or recognize that your patient's status has become or becoming stable. So the first is airway. So you should find out if the patient's airway is compromised. Second is breathing. So assess rate and ease of breathing, and assess the effectiveness of the oxygen delivery. So when you're going to help a person, find out the nose and mouth if the person is breathing. The third is the circulations. Assess for the presence of a radial pulse. So you have to check the pulse of the person if it is still beating. And assess skin color, moistures, and temperatures for signs of decreased tissue perfusions. And the third and the fourth is consciousness. So check the patient's level of consciousness. That is one of the assessment or initial assessments that you can do. And the last is safety. So ensure that the patient is safe and free from sick or from harm or injury at all times. So safety, in the emergency situation, you must help the person place to a place which is safety place. And the step 4 is take immediate actions first thing first. This is the step 4. So this is the key to the preserving life principle. A quick response to an accident can save lives and minimize the risk that things get worse. So take immediate actions is one of the most important, since this will help persons to preserve his life. So if someone needs help either from injury or sickness, you shouldn't hesitate to help if possible. So take immediate actions like CPR if the person is suffering from cardiac arrest or any kinds of problems, or treatments of minor conditions like applying the bandages to an injured area and applying a plaster to a cut or wounds to avoid worsening. So the last step is get help. So in this last step, call for medical help. So if you suspect that the sick or injured person needs emergency medical care, tell the nearby person to call 911 or the local number of emergency medical service. So if you're alone in the situations in helping a person, make the call yourself. So to help the person, rush to hospitals to provide more care and assistance. That is one way. So okay, did you understand, class? So may I repeat? The 5 steps of basic first aid principle is: first, ensure that it is safe to intervene. The step 2, first aider safety first. Step 3, conduct initial assessment. Step 4, take immediate actions. First thing first. And the last step is get help. So class, I have prepared here a video for you to understand more how to perform appropriate basic first aid principles when you encounter emergency situations like cardiac arrest, or emergency situations like car accidents, or any kinds of situations that will help you. Okay, here.
Cardiopulmonary resuscitation and defibrillation, CPRD training. Check the surroundings. Check the scene and the person. Make sure the scene is safe, then tap the person on the shoulder. Shout, "Are you okay?" to ensure that the person is unconscious. If the person is unconscious, call or ask a bystander to call the emergency number. Send someone to get an automatic external defibrillator, AED, if available. With the victim lying on his or her back, tilt the head back slightly to lift the chin to open the airway. Check for breathing. Check whether the victim's chest lifts and lowers regularly. Listen carefully by placing your ear close to the victim's mouth to listen for breathing. until 10 seconds. Attention! The person may be taking infrequent noisy gaps. This is not to be confused with normal breathing. If there is no breathing, begin cardiopulmonary resuscitation, CPR. Knee beside the victim. Place the heel of one hand to the center of the chest. Cover the first hand with your other hand. Interlock with fingers. Position yourself so that your shoulders are directly over your hands. Keep your arms straight and lock your elbows. Give 30 chest compressions. Push firmly downwards about 5 to 6 centimeters. Push fast at a rate of about 100 to 120 compressions per minute. Keep your hands on chest and allow the chest to return to its original position per compression. Once you have given 30 compressions, prepare to give 2 rescue breaths. Use the head tilt chin lift technique to open the airway. Pinch the nose shut and place your mouth over the victim's mouth to make a complete seal. Blow in for about 1 second to make the chest clearly rise. Give 2 rescue breaths. Repeat chest compressions and rescue breaths until an AED is delivered for defibrillation or an ambulance arrives. If the victim is lying in water, move him or her to a relatively dry area before using the AED. Open the AED box. Turn on the AED and follow the visual and/or audio prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
If the skin is wet, be sure to wipe the victim's chest dry before placing the electrode pads. If the victim is wearing a bra, remove it before placing the AED pads. Apply the electrode pads of AED to the corresponding positions. Plug in the connector if necessary. Make sure no one, including you, is touching the victim. Tell everyone to stand clear. Allow the AED to analyze the victim's heart rhythm. Push the Analyze button if necessary. If the AED advises to deliver a shock, tell everyone to stand clear and make sure that no one is touching the victim. Once clear, press the shock button if necessary. Immediately begin CPR after delivering the shock or if no shock is advised. Continue to follow the AED's prompts. Continue CPR until the victim exhibits obvious signs of life, for example, breathing. Or when EMS, Emergency Medical Services, a trained medical responder arrives. A collaborative initiative by French Red Cross, Global First.
Okay, that is the video about how to demonstrate appropriately a basic first aid principles. So for me to find out, class, if you really understand and learn our topic for today, for our discussion for today, so I have prepared 3 questions for you. So the first question is, okay, Jacob, okay, what is first aid? Okay, very good. First aid is the first immediate assistance given to any person suffering from either a minor or serious illness or injury with the care provided to preserve life, prevent the conditions from worsening, or to promote recovery. Very good. You may now sit down. Okay. TG, why it is important to learn the basic first aid principles? Okay, very good. It is important to learn the basic first aid principle to help the person who suffer minor or serious illness or injury saves its lives. By learning the first aid principles, we can provide a care by stabilizing the patients until the emergency medical services arrive, and also to prevent the situations from becoming worse by giving first aid. So first aid is very important, for it is a life-saving action. So very good. So the last question. So what is the purpose of first aid principles? Okay, Mark? Okay, very good. The purpose of first aid principles is to save lives and minimize the threats of deaths. So the primary goal of a first aid is to prevent deaths or serious injury from worsening. The purpose of first aid is to preserve life, prevent harm, and promote recovery. Okay, class, that is the end of our discussions. And I hope, class, that you learned on our discussions for today, for I have prepared an activity for you. So in this activity, the student will be grouped into 3 groups for a role play presentation. So they will choose emergency situational scenarios where they can apply the first aid principles. So class, I want you to group yourself into 3. So go to your respective groups now. In this presentation, I will only give you 3 minutes to practice and 3 minutes presentations. Okay, that's it. Thank you so much, class, for your nice and beautiful presentations. So, for your evaluations, in a 1 whole sheet of paper, I want you to list the basic first aid principles that we have discussed. So do you understand, class? If you listen carefully, you can easily answer these questions. Okay, very good. Are you done? So you can pass your paper here in front. Okay, thank you. So for your assignments to be passed next meeting, so I want you to draw the materials and tools inside the first aid kit. So the title of your activity is the first aid kit must have. So you can use any coloring materials to make your drawing beautiful and presentable. So that's all, class, and I hope that you learned for our discussions for